Good afternoon, everybody, and welcome to Lincolnshire Partnership's Annual Public Meeting. My name is Jane Marshall. I'm the Director of Strategy, Planning and Partnerships for the Trust, and I'm here representing Brendan Hayes, our Chief Executive, who can't be with us today, to give an overview of the last year and our strategy going forward as an organisation. I'd like to start by talking about our geographical spread and the number of sites we have. Obviously, as an organisation, we specialise in mental health, learning disability and autism services, and we serve 756,000 people in Lincolnshire. In addition to that, we are lucky enough to provide services into North East Lincolnshire as well, where we provide children's and young people's mental health services. And there is a population in North East Lincolnshire of 160,000 people that we serve. We do that across a huge geography. When you look at the profile of our population, we have 55% of the people we serve are adults, 23% of the population are aged over 65 years and 22% of our population are young people. And we currently operate across 50 bases throughout that geography. So a lot of different community bases that we provide our services from. In terms of our service users, what we know is that we have approximately 50,000 people who are receiving services from us at any one time, and that there are currently 360,000 appointments per year, roughly, that we provide as we go about delivering those services. So that's a little bit about us and what we do. If I can move on to some of the things we've been paying attention to over the past year, we have had an improvement journey that we've taken in terms of the quality of services that we provide. And my colleague Anita Lewin, who's our Director of Nursing, Allied Health Professionals and Quality, is going to say a little bit more about the detail of that. But if you look at very high level about the journey we've been on since April 2016 to the current day, we can demonstrate through our regulators that we have worked hard with their support to improve our ratings against the Care Quality Commission's assessment, and we've moved to a really good position, being rated good overall for our services, which is great. So we are caring, effective, responsive, safe, and we're rated good for those, with an outstanding rating for our well-led element that were assessed by the CQC. We're very proud of that, because what that means is that we are able to provide very good services for the people we serve, and we do that across a range of different services provided by our organisation. Those services range from very specialist inpatient services that we do from our wards, through to more primary care facing community services, such as our Steps to Change IAP service and our community mental health teams, that we're increasingly looking at all age services and doing things not relating to any level of age, but doing things consistently, whatever age you are. We were lucky enough to have a Care Quality Commission visit earlier this year, and that confirmed our ratings as good overall, with outstanding for well led. We were lucky enough to have an assessment of our rehabilitation services, and that resulted in some change to our ratings, but we retained a good for that service overall. And that service particularly is going through a lot of change at the moment, where we're looking at delivering different models and improved models of care. As I said, Anita Lewin, our Director of Nursing, AHPs and Quality, will explain more about that as we go through. So really good results on our assessment of our quality as an organisation. The next area that I'd like to speak about is how we perform as an organisation. And again, it's a really strong position that we're in, and that has been continued strong performance over the last year. We have been able to maintain our score of 1 for the NHS Oversight Framework, which basically is an assessment framework that looks at how organisations use the resources that are available to them and how effective they are in making sure that we spend money in the right ways to target improvements in patient care and deliver the right services. I'm really pleased that through the good work of all of our organisations, supported by our expert finance team, we remain in segment 1 as an organisation, which is a really great place to be, because it means we do well on our resources and our money. The second area that I'd like to talk around is what patients think about our services. So we're measured according to what's called a friends and family test, where we ask friends and family what would they recommend LPFT services to their friends and family. And we currently have around 90% of our patients saying they would recommend LPFT to their friends and family as a place to come and receive services. We're very proud of that. In addition, we have around 4,000 expressions of thank yous, of satisfaction for our services, and we are making sure that we are not complacent, that we continue that good performance, but we continue to make sure we improve all the time with what we do. So we are continuing to focus on reducing the number of people who have to travel out of Lincolnshire for their care. We call those out of area patients. And there is a national target to eradicate inappropriate out of area patients by next March 2021. You'll hear lots of what we're doing, what our teams are doing to increase our capacity, to reduce the number of adults with acute mental health who have to travel outside of Lincolnshire for their care. Previously, we had around 50 people going out of area, but we're making really good progress. We're now down to around about 20 people out of area. That's still too many, but we have an absolute plan to reduce that number to 0 by the required deadline of the end of March 2021. And what that is a really strong indicator of improving quality of care, because we know that there are all sorts of knock-on impacts which don't make the patient experience good if you're having to travel a long way for your care, including the fact that by definition you're away from your family and friends. People find it more difficult to visit you because you're away, and generally speaking, your recovery takes longer if you have to travel further. So we're working really, really hard to eradicate the number of times that happens inappropriately for the county of Lincolnshire and the people we serve. The other big area we are focused on, in addition to our core delivery of services, is of course improving care for people who live with a learning disability. And under the Transforming Care policy, which is a national policy about home not hospital for people with learning disabilities where we can, we are working hard with our clinical commissioning group colleagues to make sure we meet the expectations of that policy, and that people who require support, who have a learning disability and autism, are seen as close to home as we possibly can make it, and that if they do receive hospital care, that is absolutely of the best quality we can make it. So we'll continue our focus on the National Transforming Care Agenda, improving the links between mainstream mental health services and our learning disability specialists, to ensure that reasonable adjustments are made and people are able to access the most appropriate services for their needs. And the final thing I want to speak about in this section is our commitment to carers. Carers are really important to us, and we know that carers are on the front line every day, but have been particularly important during COVID-19 and the crisis and the pandemic that we've had. So we're ensuring that through the work we're doing to come out of COVID and through our recovery, we are really listening to the voices of carers in terms of what they need, what help they need to get them through the COVID pandemic, but also how we strengthen our partnership with carers, as they are an absolute key part of our workforce and we regard them as such. That without them, we wouldn't be able to do the job that we do. So really important that we continue our commitment to them and pursue something that we call the triangle of care, which is essentially the partnership between the patient, the carer and our organisation LPFT. So we get that triangle right and we do everything we can to support our carers. We're proud to be a member of the Triangle of Care, which is an accredited scheme. And we currently have 2 stars in the Triangle of Care, which is a really good place to be, because that means the organisation's been assessed according to an accredited framework about the care, the support we are able to give our carers, and we've come out really well on that. So we're looking to keep those 2 stars as we go forward and continue our commitment. A couple more highlights for us. 100% of our patients who go through crisis assessment before admission have had a thorough assessment of their needs before admission over the last year, thanks to the great work that the crisis teams do as part of LPFT and our new psychiatric clinical decisions unit, which is doing great work. The second area we'd like to highlight is that our crisis teams have continued to meet their target, which is to see patients referred to crisis teams and make an initial contact within the 4 hours. It's our equivalent of the 4-hour A&E target. And the teams have been constantly improving the work that they do and have absolutely met consistently that target over the last year. We thank them because it's really important to get that response within 4 hours to people in crisis. The third area we'd like to talk about is our Section 75 contract that we have with the local authority, with Lincolnshire County Council. A really important service where we have our social care, social workers working with us, and we've completed social care reviews and are now meeting the target we're required to for those patients, for those service users. And the fourth area I'd like to mention is our Lincolnshire IAPT Steps to Change. IAPT stands for Improving Access to Psychological Therapies, and we've seen continued strong performance from those teams, which are based across our county. So they are currently meeting higher than expected rates for patients recovering through that service. We're doing well on our waiting times within 6 weeks, where we're significantly above target, and we're improving the access rate so that more people who need that service and are eligible for that service receive that service. In terms of our challenges on performance, we've had some challenges around the amount of money we spend on staff who come from agencies, but we are committed as a board to providing safe, quality services. And whilst meeting the agency spend target is important, we don't compromise safety and quality just to meet that target. We've also had some inconsistencies in our performance against what we call the care programme approach, which is about patients who are discharged having follow-ups within 7 days of them being discharged. But we have ended the year above our required 95% target. Again, that's a really important target for us that we take very seriously and we monitor really closely. We know also that physical healthcare checks for our patients, for our inpatients, are important, and we've done a huge piece of work to make sure we are consistently making sure that physical healthcare checks for our patients are available. And Anita, our Director of Nursing, AHPs and Quality, will talk a little bit more about that as we go through our meeting. One area where we remain having challenges is what patients are saying to us as part of what we call our community mental health survey. And that's a survey which asks patients who are in receipt of our community mental health services what they think about those services. We had seen some positive improvements last year in what people were reporting back to us, and we've done a lot of work to try to work hard to make sure we are constantly improving those services, both now and for the future. What we need our public and our patients and our stakeholders to be assured of is the fact that we take that survey really seriously, and we'll be looking to further improve our community offer as we go forward as an organisation. So this year, the year that's just gone, we've seen some huge investment in our services, which has been really, really welcome. But I think it's fair to say virtually every service line, all of our services are affected by change at the moment and are affected by what we need to do to bring additional services so that we can improve the range of services that we provide. And we've had change across all of our divisions, and I'm sure our associate directors will talk about some of that as we go through our meeting. In terms of some of the highlights, we've been able to introduce a 24/7 mental health helpline, which has been a really positive development for our patients, for our service users and for our staff, in that now some people have somewhere to ring 24/7 if they have a mental health issue that they need support with. That's a brilliant new development, and we thank our staff, our partners. So we do that in partnership with Mental Health Matters, which is a key partner for us, but also our clinical commissioning group and local authority colleagues who've helped us put that service in place. That's been invaluable during the COVID-19 crisis, as you'd imagine. In addition to that, we're seeing more and more investment in community services, so crisis cafes, additional community rehabilitation services, which allow us to get our patients safely discharged and supported in the community. And that's a brilliant new service for us, the community rehabilitation service that we've brought on stream this year. In terms of other areas of transformation and improved ways of working, we've had tremendous success in our older adult clinical division with some of the new mental health services they've put in place, including home treatment teams for people with functional mental illness, but also for people with living with dementia. We've got a great new dementia support service, and we've been lucky enough to have one of our older adult inpatient wards, Brant Ward in Lincoln, refurbished. It's a really smart new environment, which is much better for our staff and much better for our patients. In our community division, we've had great success with our veteran services, with our individual placement and support service, which basically provides employment opportunities for people who are part of our community mental health teams. We've introduced a new personality and complex trauma service. We're doing great work with people who are sleeping rough on the streets of Lincolnshire to support those people. We've had great work on our criminal justice liaison and diversion service, and all of that supplements the really fantastic work that our community mental health teams do every single day. And finally, our specialist division, where we run some of our very specialist services, including our children and young people service, our learning disability service, our autism diagnosis and support services. So we've seen lots of expansion of crisis and community support for children and young people. We've got a Here For You helpline that we are providing that telephone support to people who need it, and provides a single point of contact and liaison. And through our learning disability teams, we are doing great work to make sure that the cohort of patients who come under the Transforming Care agenda receive the care that they need. So if I move quickly on to some of our achievements this year, we are in the top 10% of all trusts in the National Staff Survey, which is a survey that assesses what our staff think about working at LPFT, that's a great place to be. So for our 2,500 staff, that means that people enjoy working with LPFT and are committed to continuing, hopefully, to do that, and we need to support them. We are rated top in the East Midlands for our junior doctor training, and we have invaluable support from our volunteers who work with us on an unpaid basis to help support our pathways and the patient journey. So moving on quickly to our COVID-19 response, we'd like to say a big thank you to all of our staff and our volunteers for the way they have all responded to the COVID-19 crisis. We have adapted quickly. We have made sure that we've learned as we've gone, and people have stayed with us as we've learned to use PPE, personal protective equipment, as we've worked in different ways to make sure we could still deliver services. We've implemented a huge range of alternative ways of working, including online and digital ways of working, so that we could continue to make contact with our patients even though we were in lockdown and give them the support that they needed. We've upskilled our staff in terms of responding to physical healthcare needs of people who might be affected by COVID-19, and we've extended community support to prevent hospital admission during the lockdown period, as we knew it was more effective to keep people at home. So we'd like to say a big thank you to how our staff have responded. In terms of where we are at the moment, we're moving on from COVID-19. Our staff are now starting to return to their bases with appropriate measures in place, and they have commenced face-to-face working, seeing patients face-to-face, obviously with protections in place and social distancing to support both patients and the staff in that offer. We've increased our digital offer, but it's digital first, not digital only. We recognise that there is an element of digital poverty within our county, and some people don't always have access to either broadband or the connectivity they need. So we're continuing to lock in the benefits that we've learned from COVID-19 by an increased digital offer, but we're making sure that we personalise that agenda as much as we can to make sure people have a service on the basis that they need. So if I just briefly now talk about the changing landscape under the impact of COVID-19. The impact of COVID-19, we think, means that more people with mental health and emotional well-being difficulties will need to come forward for service. So we're encouraging people to do that. If you have a mental health problem that you need help with, then please step forward. We are open for business, and we want to be able to provide you with the services that you need. We recognise there'll be a big economic impact of COVID-19, and as I said earlier, we recognise that there's potentially more mental health problems starting earlier in childhood, and that we need to support children and young people in school and out of school more effectively. But we welcome the fact that through COVID-19, we're having a very good conversation about mental health and well-being, and that we're working with our partners to make sure that where people need support, there is something available to support them. Part of that support will come from LPFT, and absolutely right, from our specialist services, but we're also looking at different ways of working so that we can make sure that health and wellbeing options are available to people in their local communities, close to home, so that they can get access to the support that they need close to their homes and when they need it. We have something very special, which is a mental health investment standard, which gives mental health better clarity on the levels of funding that need to go in to ensure that we can increase our workforce to respond on the front line of mental health services. And we are therefore seeing, which is really good news, significant investment in our local mental health services to support us with our work. And we're working in partnership with our clinical commissioning group colleagues on that agenda and making sure that if people need a mental health service, they have access to that. I think it's really positive that we're building on changing attitudes to mental health, mental illness and mental well-being that we know are really important. Our partnerships are really important to us. We work in a Lincolnshire system. We work with local authorities, with voluntary, community, social enterprise sector partners, with our clinical commissioning group colleagues, with a range of other organisations, and that's really important to us as a partnership organisation. We are working on what we're calling the Joint Lincolnshire Long-Term Plan that sets an ambitious agenda for all services in Lincolnshire, including mental health, learning disability and autism services. And we are partnering with our colleagues to think about becoming an integrated care system by next April, really working hard to look at how we can integrate what we do with other organisations so that patients see the benefit in terms of seamless pathways, and that as services we see patients as a collective responsibility and work collaboratively with others to deliver services to different people across our county. In terms of our ambitions then, we have ambitions around prevention, so getting in early where we can to prevent ill health and making sure that we have earlier access to support close to home. As I've just said, we're looking at greater integration with others about how we deliver our service. We are absolutely committed to increasing the number of and range of services available in local communities, while making sure that if people do need an inpatient hospital bed for their mental health, we absolutely have those services available in Lincolnshire and that those are of the best possible quality we can make them. We are looking, as I said earlier, to ensure that our ward-based services are fit for purpose, and that includes eradicating some dormitory accommodation that we still have in some of our wards. And that basically means that people don't have access on some of our wards to their own bathrooms. Some of the beds are in dormitory accommodation still, and that's unacceptable to us as we provide the services that we provide. We are absolutely have an ambition to eradicate that dormitory accommodation, and we're working closely with our clinical commissioning group and regional partners to try to get investment to make sure that we can eradicate that poor accommodation. We are looking to make sure that we repatriate our out of area patients who are inappropriately placed. We are absolutely committed to making sure that we improve access but reduce the length of time that patients wait, and we're looking to introduce new roles, different ways of working to help us do that. We also recognise that we need to retain the wonderful staff that we have, but invite other people to come and work at LPFT, and we'd urge people to keep their eyes out for the opportunities that there are for recruiting into our organisation. And if you are interested in a career in mental health, learning disability and autism, please check out coming to join us as we expand our services. So thank you for listening, and I hope that gives a reasonable summary of some of the work that we've been doing over the last year. We're very proud of what we've managed to achieve, and we're looking forward to doing more in the future. Thank you.